Lesson number 5 of Alcohol Awareness Series, Alcohol and the Heart. Not a tonic, but a threat. Namaskar, I am Dr. Rajendra Nanavare. In this session, we are breaking a major myth that alcohol is good for the heart. Many believe a small drink improves heart health, but the science says otherwise. So first part, the heart always in action. The heart pumps around 1 lakh times a day. It needs healthy blood vessel, a steady rhythm, and oxygen-rich blood. Alcohol disturbs all the three dysfunctions. Second, how alcohol affects the heart? First is a high blood pressure. Alcohol raises blood pressure even in a small quantity. Irregular heartbeat, that is a arrhythmia. Alcohol causes skip or racing heartbeat, especially holiday heart syndrome, cardiomyopathy. Long-term alcohol use weaken the heart muscles, increase risk of stroke due to clotting or sudden bleeding, raise cholesterol and fat levels, leading to heart blockages. Third, the red wine is good myth. Earlier it was believed red wine in moderation would be protective. Recent WHO and CDC data shows there is no safe level of alcohol for heart health. Any benefit is outweighed by the risk of stroke, hypertension, and heart failure. Fourth is that young people are not safe. Alcohol-related heart disease or heart problem can begin in youth, especially in a binge drinking patient. Sudden cardiac arrest is the rising cause of death in young adults. Fifth, alcohol and diabetes. A dangerous pair, alcohol interferes with sugar control, worsen insulin resistance, and increase triglycerides, leading to a higher risk of heart attack in diabetic patients. 6. Women are at a higher risk. Women have lower body water content and metabolize alcohol differently. Their heart are more vulnerable to damage even at a lower doses. 7. Symptoms to watch: chest discomfort, irregular pulse, fatigue, and breathlessness. Bilateral leg swelling. Often these are misattributed to stress or aging. To conclude, alcohol is not a hard tonic. It is a ticking time bomb. Let's stop the myth, start the truth, and save our heart. In the next lecture, we will explore the link between alcohol and cancer, a risk many ignore. Thank you.